We're going to take a moment to talk about men's health, especially when it comes to undergoing serious procedures like vasectomies. And there's actually some interesting developments as the economy gets worse. We have with us Dr. Shaw with the Austin Diagnostic Clinic this morning to talk about vasectomies and some changes you're seeing as far as how many people are getting them. Good morning.
Right. Good morning, Jenny. You're right. What's happened is just with the economy, everyone's watching their budget, and it costs quite a bit of money to raise a family and raise them well. So we're noticing that most insurance companies cover the cost, part or all of the cost of a vasectomy. So we're noticing a large increase in the number of men who are looking to this as a safe, effective method of birth control.
Very, very interesting. So because before, fewer men were getting it done, and it was more women getting their tubes tied to prevent pregnancies, right? Are you seeing that change? The more men are getting it, kind of coming up even with women, or no? Right.
An interesting fact is that about 15% of women get tubal ligations, which is a surgery you have under general anesthesia. Only 5% of men actually opt for a vasectomy. And I think that with the advent of the internet, people talking to their friends, they realized that there are a lot of myths and as well as good facts about a vasectomy, that it's safe and very effective. And so a lot of men are actually not becoming as wimpy and deciding to go for it and have it done.
Well, let's talk a little bit about a vasectomy. How does it affect a man afterwards? Does it affect his life, his marital life with his wife?
Right. I think a lot of men rightly get pretty nervous when someone talks about getting a knife near their privates.
Right.
And so, but indeed, there are two small incisions, about 5 millimeters each on either side of the scrotum. It's a 15-minute procedure in the office, but importantly, has no effect on testosterone production, no effect on erectile dysfunction, orgasm, or ejaculation. So you're completely unaffected.
Okay, so that's probably one thing that worries a lot. That's probably one of your most common questions.
Exactly.
I can imagine. Does it immediately make a man sterile, or does it take time?
No. So going forward from the area that we cut, there are several 100 million sperm that are ahead of that area that are already in the pipes, if you will. So we basically have men have roughly about 30 to 40 ejaculations over the period of 2 months or so. They have to continue to use protection until that time. We then check a semen analysis at that point, make sure there's no sperm left, just to make sure that we've done the appropriate procedure and our patient has done their end of the bargain, and only then do we declare them kind of safe to proceed with intercourse without protection.
And how long does it take the surgery itself? How long will they be in the hospital?
Right, so it's actually done in the office, which is wonderful. We use a local anesthetic. It takes about 15 minutes to do.
Wow.
So yeah, and so we typically do it Friday and sometimes Friday afternoon, so you don't have to take too much work, time off of work. And now we actually do Saturday clinics at Austin Diagnostic Clinic, so even easier, no time off from work, back to work on Monday.
So they're usually able to recover pretty quickly?
Yes.
Wow, that's a lot of good information. And so when should a man consider getting a vasectomy?
Well, certainly a vasectomy, another good thing about it is that it is reversible. However, you want to make sure if you're going to have this done, you're pretty sure with your spouse or your significant other that you've had the children that you have had or not, and so family planning is very important.
And I know we did have a graphic up there. I don't know if we want to show it again. How you can contact Dr. Shaw. You're with the Austin Diagnostic Clinic, and if you have any questions there about vasectomies or about anything having to do with that realm of the medical world, give a call to Dr. Shaw over there at the Austin Diagnostic Clinic. Thank you so much for joining us this morning.
Great, thank you.
A lot of good information. Appreciate it.